So welcome everybody to our collaborative conversation. So this is a partnered event. It's a wonderful opportunity to bring together MIRA and the Collaborative for Health and Aging here at McMaster and highlight one of our favorite studies, the EMBOLDEN trial. So I am Audrey Paddocks. I'm the research manager at the McMaster Institute for Research on Aging. And we have two wonderful speakers here. But before we begin, I'm going to tell you a little bit about what brings us all together and some of our shared interests and the things that we think we do really well together. Can you show me the next slide, Allison? So before we get started, I just want to acknowledge the land that we are all here on. So we're at McMaster University in Hamilton, Ontario, and it's located on the traditional territories of the Mississauga and the Haudenosaunee people, and within the lands protected by the Dish with One Spoon Wampum Agreement. And I encourage you from wherever you are tuning in from to think about the lands that you are on and to think about the ways that we can respect those lands and continue our journey in reconciliation with the original inhabitants of those lands, wherever you may be. Okay, and so this slide is meant to hopefully explain a little bit about how we all work together. So the McMaster Institute for Research on Aging is a pan-university institute. That means to connect all of the different disciplines who are doing aging research. We also act to sort of bring people together around areas of interest, whether that's the community or different folks who might not ordinarily interact. At McMaster, there is a wealth of expertise. There are a whole variety of platforms who are doing excellent work in aging. And you can see on this figure here, some of those. You can see that the Collaborative for Health and Aging is one of them. We also have the Labarge Center for Mobility and Aging, which funds research and initiatives and training. And so the EMBOLDEN trial has been funded through the LCMA. And I'm going to tell you a little bit more about each of those before we learn a lot about the EMBOLDEN trial from Maggie and Aref. And next slide. So a little bit about MIRA, because I have the opportunity to tell you about it. So if you are not a MIRA researcher, trainee, or a member of our community, you can become one of those. You can navigate over to our website, or we'll have some QR codes. But we essentially serve to connect researchers at McMaster, trainees at McMaster, and older adults and other stakeholders to each other and to the research happening on aging. And we just sort of seek to facilitate a collective approach to research questions. One of the ways we do that is using design thinking. You'll see Post-its in most of the pictures I'll show you. We like to get people together to brainstorm. There are no bad ideas and learn from each other. And so we do that to really iterate on problems and solutions and think about new ways to approach them. We also encourage interactions between the different collaborators in the different disciplines and folks who are doing all kinds of different types of research at the university, and bring older adults and stakeholders into those conversations to understand what people's pain points are and what they'd really like the solutions to look like. We bring trainees together. We're going to have a trainee workshop after this. And so we really hope to build capacity, help people learn new ways to do their research, new skills from each other. We have a lot of trainee events and funding. And so if you are a trainee and you're not a member of the trainee network, get in touch with Jazine Alders, who is one of our hosts today, and she'll make sure that you know everything you need to know to become a MIRA trainee. And we fund research opportunities, one of them being EMBOLDEN. We also fund smaller grants and trainee research scholarships, grants, and fellowships. And so if you are in the business of looking for funding for research and you're at McMaster, you should visit our website and take a look at what we've got available. So the Collaborative for Health and Aging is a branch of one of the many platforms that does aging research here at McMaster. They serve to connect older adults to research and get really meaningful impact. We often have people come to us at MIRA and say, I want to do this project. How can I talk to older adults? How can I learn what their perspectives are? And we connect them directly to the collaborative and tell them to get in touch and see how they can get people involved. And you'll hear a little bit more about how they engage with older adults. If you want to be connected to the collaborative, there's a QR code on the slide here. You can scan that with your phone, or maybe there's a link in the chat. Excellent. And so they are doing some of the great work on aging research at McMaster, just one of the many platforms that we have here. And so EMBOLDEN, a few years ago, we sought to support research in an area that we knew was really important to older adults. which is nutrition, mobility, and social connection, and how those things could be tied together in a meaningful way that sticks. Lots of times people try to make changes for a variety of reasons. They don't always work out for folks, even though that they want to be more active, be more social, and eat healthier. And so we had a lot of meetings. People came together. We brought in folks from the community, folks who work with older adults, and we Rebecca Ganon is the lead of Embolden, and they really listened to what people had to say, which is that they wanted a sort of a coordinated approach that was rooted in social connection. And they developed the study that you're going to hear more about, and it's really become one of the pillars of the aging research that we support here at McMaster, and that's funded through the LaBarge Center for Mobility and Aging. So really one of the success stories that we have, and really exemplifies the way that we want to see research happen at McMaster. Okay, so that's enough about all of that from me. I would like to introduce today's speakers. So Dr. Maggie MacNeil is one of the key folks who works on the Embolden project and is going to tell you a lot more about that and how that that project came to be and how it's worked with older adults. She's a postdoctoral fellow here at McMaster, and she's got with her Aref Alshaikhahmed, and he is a key participant in the Embolden study, and he's really helped to provide insight along with some other folks we have in the room here, and really help provide the older adults perspective in ways that I think will be enlightening to everybody here. So I'm going to turn it over to Maggie.
So hi, my name is Maggie MacNeil. I am a postdoc in the School of Nursing. Small disclaimer, I have no clinical skills. My background is in policy, public health, and aging. And I have been working with Dr. Rebecca Ganon in the School of Nursing. And I also wanted to mention that part of this work is was funded by an LCMA, or LaBarge Center for Mobility on Aging scholarship that was co-supervised by Julia Abelson. I'm also here with Aref. So Aref and I met in 2020. We both joined Embolden around that time. There was a smaller group that did some development work to kind of get Embolden off the ground. And one of the things, one of the pieces of feedback that we heard was you'll need to have more older adults from the neighborhoods you plan to implement in. So there was kind of like there was a wave of people who came into the guiding council, kind of like a wave where it got bigger, and that's kind of where RF came in. And we were so grateful to have RF. He has over 2 decades worth of experience working with the United Nations on a few different topics, and he can tell you more about that. And I also wanted to say we're here on behalf of quite a big team, a lot of expertise. You know, there's no co-design evaluation if there's no Embolden, and there's no co-design evaluation if Embolden decided to design their trial without co-design. You know, you can design a trial in many different ways. So we're here representing that big group. Some of the goals today, or what we think you might learn. You'll hear from Aref, you'll hear from an older adult who's a member of the SGC, and we will focus a little bit on how Aref has helped us translate some of the findings from Embolden, and including the paper, which you might have seen linked out, and also how Embolden operationalized some aspects of engagement, and how we work to evaluate it. So the context, why do you need Embolden? Audrey kind of alluded to this, but mobility can be a complex problem, and it involves a whole bunch of different things. And I think if you work with older adults, you've seen people who kind of they can get into a spiral of decline where their mobility changes, they become more isolated, it affects their mental health. So like short-term quality of life impacts and long-term more serious impacts. So the other thing is there's so much good knowledge about how to promote mobility and what works in a lab. So I think part of one of the drivers that I've hung on to about Embolden, or why we need it, was just this knowledge gap of knowing what works in a lab and not knowing why it doesn't work in the community, or why it doesn't work as well. So one of the gaps that Embolden seeks to fill is a program that considers older adults' preferences and needs in order to see that real world impact. So the goals of Embolden are there to promote mobility, to address gaps that older adults in Hamilton face. One of the goals is clearly to co-design the program and also to consider the long-term sustainability of the program. So past the kind of research study phase into longer term. And so what do we mean by co-design? I mean, it sounds simple, design together. Aref and I are co-presenting, but the engagement literature makes it much more complex and kind of everybody can define co-design differently. In Embolden, we used a methodology called experience-based co-design. And basically what that entails is bringing together the kind of end users. So there's different language depending on who you're working with. Some people say consumers, carers, end users, citizens, older adults. That's one of those things that you'll have to negotiate with the folks that you're working with. But bringing those people together to talk about, how to make a program that would work. I need to say really quickly, why should we do co-design? And if people want to nerd out on engagement literature, we can definitely do that later, but I didn't want to bore people too much with methods. But basically, we know that involving patients, it can improve research. It can help you do more relevant research, reach more people, do more rigorous research if you're addressing things that are important to your target population that you haven't thought of yet. It's also pretty democratic. I know that coming from public policy, I know pretty well that health is the biggest line item in any provincial government budget. The CIHR's budget is $1 billion a year. So I think that's our money. That's our taxpayers' money. So it makes sense to have people involved in that process. And so as smart as I think it is to engage people in research, it's still not that common. Some people estimate 10 to 20% of research of health research engages older people or engages the target population. I say older adults, but I recognize that not everyone's doing that. And it's even less prevalent in trials. So there's this one study that showed that it was less than 1% of trials reported engaging patients. And that was like over 350,000 trials. And so given that if we're talking about democratic ways to spend taxpayer money, trials are a really expensive way to do research. So I think a really important place to have engagement. So this is the goal of the co-design process in Embolden. So looking at designing priority features of a mobility intervention. And even that language, priority features, might not mean much to you, but how we operationalized it was recognizing that mobility is a complex kind of issue or problem. There's lots of different contributing factors to whether you're more or less mobile. So we knew that these 4 elements up top would be part of the intervention, but how those got operationalized were more flexible, and that's where the co-design piece came into play. And so I always like to think, the operationalization was open. Like, had we heard from the co-design that the only exercise or physical activity that people wanted to do was Zumba, that's one of the flexible elements. That's where we were at with this. If they said healthy eating needs to look like this, we didn't hear that, but just recognizing the kind of fixed pieces. And as somebody that didn't do a lot of engaged research before I came to my postdoc, it can feel overwhelming to know what good engagement looks like and feel like you don't have the, resources to do that. So that fixed and flexible part, I think, helped to streamline some of the possibilities, even for me as someone joining the project. And so Embolden's a multi-phased research process. That green circle tells you where we are now. And as you can see, it was always designed to include a strategic guiding council. And that's composed of older adults and service providers. So it ended up being 8 older adults and 26 service providers. to support the research throughout those different phases. We also just wanted to note here, and Aref and I have presented before, and one of the pieces was, oh, it's so unattainable to do engagement that way. And I think it's Embolden is a good exercise in seeing how one grant can lead to another and lead to another. And even the co-design phase was one grant in itself. So yeah, there's lots I've learned about how to kind of do that whole piece as a trainee for sure. And so this, I think one of, like I was saying, some of the hard things is if you're looking at doing engagement research and you're reading the literature, you can look at a framework and it's hard to think about how that works for your project, or how does that framework turn into activities for your project and your group. So this slide is to think about in that co-design phase, what did we do? What were the activities? So there was some research evidence that would get brought to the group to interpret and have feedback about. There was some work environmental scanning programs in Hamilton, services in Hamilton, in places where there wasn't good information about the city or about a research aspect. We would look to somebody on the team to come into the SGC and present. And there was also a qualitative study. So this was where older adults were participants in a study, and we asked them about the highs and lows of their experiences going to community programming in Hamilton. And so I mentioned before the priority features. So these are, and how some of them were flexible. These are some of how those flexible pieces played out. And some of the decisions that Embolden was able to come to with the help of the SGC. So duration, frequency of the program, what was the format, how often was it going to be, and kind of who was going to deliver it as well. And I do want to highlight that the intervention delivery team is integrated providers. So it's contracts with providers that are already working in the community that we have, or that Embolden has, kind of seconded to help us with the delivery. And when we say who are those 18 service providers, these are some of the community research partners. They represent some of the agencies that the service providers on SGC were working in. And so we've been alluding a little bit. It's hard to tell you about an evaluation study if you don't say what was the thing you were evaluating. So this was the sub-study that's been my kind of postdoc project. So we were looking at evaluating the impact of engaging older adults and service providers. So looking at the impacts of that co-design phase. And it ended up being a mixed method study. And so that is suitable for developmental evaluation. If you're a methods person, developmental evaluation is a participatory method. So it's often looking at program stakeholders, involving program stakeholders in figuring out what to evaluate and how to use evaluation findings. And it's focused on, a complex environment where, like a health and social community program, and how to use those findings and bring them back into the program in order to improve it. And so I invited the entire SGC to help me think about the project if they wanted to. So that invitation went out to the 26 folks. And it was 4 of the older adult SGC members that agreed to help me think about the project. And as someone, I'd done policy work, I'd done some evaluation work, I knew the evaluation needed priorities and it needed a focus. And I felt uncomfortable about choosing the priorities. And that made me feel like stuck for a while, because I was like, we need priorities, we need a focus, but I'm new here. Why should it be me? And then the light bulb went on and I was like, oh, it shouldn't be me. And so that was when the 4 older adults decided to come and help me think about what's the most important thing to measure as far as the co-design process. How do we measure it? Like, what data do we need to capture? What data, what methods could we use? And just in the spirit of being open and transparent. I remember showing a slide that had like a list of methods of like every method, survey, interview, focus group. And it was like, here's some of the options. How do you think we should capture those things? And so one of the things we heard was that they thought it was important to show the impact of the guiding council. But also they said, we think it's important that you engaged us at different parts of the research. So we want to know what our impact was across the different stages. And I would also say that I know I thought that we would do interviews. So when I had that slide with all the methods on it, I was thinking it would be interviews. And what we came up with was a survey, focus groups. It was felt that they would be more expedient to have people talk in a group. And when I heard that it was, the impact and the impact across time that was interesting to folks, decided to use document analysis of meeting minutes in order to trace those like specific decision point impacts. I know you guys probably all work on projects that can go on 2 years. And if you were part of a focus group that asked you what was your impact on that project, it might be hard to say that you might more say general things. And so my timing was good. So now I'm going to hand it over to Aref to talk a little bit about, so you have this slide and the next slide. He's going to talk a little bit about his perspectives on the SGC. And, the researchers frame it one way, and the people can frame it in another way. And so you will, here you are.
Thank you, Maggie. Thank you, everyone. I'm going to talk about my experience with Embolden. Yeah, who I am. I am Aref Alshaikhahmed. Last name Alshaikhahmed. It is 2 words, but when I came to Canada 7 years ago, one of the migrant officers merged them together. So it became Alshaikhahmed, 1 word. Yeah, a long last name. Anyway. I want to start talking about myself, as I am highly interested and passionate working for the community and with the community and for the community. At the moment, I'm a member of a Strategic Guiding Council, SGC, and also a member of Hamilton City Senior Advisory Committee and its 2 subcommittees, communication and elder abuse working groups. Also, I'm a member of advisory committee of McMaster Discovery Program, and a member of PERC, Patients and Research Collaboration, Patient and Expertise and expertise and research collaboration, and also
We work on that together.
Yeah. And also, I'm a member of SARC. It is a Senior At-Risk Community Collaborative. And it's my pleasure to be part of this event together with you. I wanted to mention that back home, in Syria, I worked for 2 UN organizations. The first one is UNRWA, United Nations Relief and Works Agency for Palestinian Refugees in the Near East. I was working as a field relief and social services officer, responsible on the relief and social services program, and also worked as a project coordinator for UN Women, United Nations Entity for Gender Equality and the Empowerment of Women. Yeah, so when I came here, since I came here, I was very active in terms of volunteer work. This is, I think, that something of who I am. In terms of how did I get involved with the Strategic Guiding Council, I attended a presentation about Embolden and its goals in one of the Senior Advisory Committee meetings. The Embolden Project Coordinator, Caroline Moore, came and they make a presentation about the Embolden and invited volunteers to join the SGC to participate in co-design a process. And I found out that the Embolden team was very eager to attract stakeholders to their study. Therefore, I applied, signed a consent, and became a member. Yeah, concerning why did I join the Embolden SGC? Actually, when I heard the presentation that was presented about Embolden, I found out that the objectives of the Embolden match with my values and beliefs. Yeah, in terms of improving the quality of life of older adults, in terms of physical activity, practicing physical exercises, having healthy food, and engaging in social activities. Therefore, I found out that this is what what the older adults need and want. Therefore, I joined. In addition to that, I also joined the SGC in order to share my perspective as a senior with the Embolden team. So this is the reason why I joined the Embolden. What have I done as an SGC? I think that the most important thing that I have done is to share my perspective as a senior with the Embolden team. I wrote down some of these, what I have done. I participated in project-related discussion. I also, as the SGC member, I communicated some of the needs and concerns of the older adults community. I could identify some gaps and barriers in physical mobility, access to healthy food, and encouraging and engaging in social life. Also, I shared as I said, I shared my perspective as a senior citizen throughout design planning, monitoring, and evaluation. The SGC were brainstorming sessions. Yeah, so I actively shared the ideas, sometimes not previously on my mind. I participated in developing a shared vision for the experience of older adults and how this should be evaluated. I participated in raising awareness about Embolden findings and lessons learned with my friends and community members. In addition to that, I participated in co-author in 2 Embolden studies. One of them, the effectiveness of system navigation program linking primary care with community-based health and social services. And the second activity, this presentation that we presented it in conference, in aging conference in Toronto, together with Maggie. I also attended the 50th anniversary meeting of the North American Primary Care Research Group in NAPGRAD in Phoenix, Arizona, where NAPGRAD hosted 875 researchers from 14 countries. So this is what I did. I think that, as I told you, that the most important thing, I feel that I have a loyalty to Embolden. I feel that I have the ownership, and this is the most important thing that Embolden could create. That we as stakeholders, we became partners. We became too close. We are interested in that Embolden succeed. Yeah, and this is what we are doing. I do my best, for example, to raise awareness in my community about the findings of the Embolden. So I see that Embolden is helping older adults to improve the quality of their life. Yeah, and I practice something in terms of the physical movement and practicing exercises, physical exercises. This is personally, I get benefit of this knowledge that I gain. and uh, and that's it. I think that it is very important, and also I communicated the importance of working on sustainability of this project.
Thanks, Aref. And so there was one thing that I also wanted to say about this slide. So I mentioned that we did a focus group and that it was important to the older adults that that was an expedient way to collect data. And they also said they didn't think the focus group should go longer than 45 minutes. And so being the researcher, I had like a 30 question list of things I wanted to ask in the focus group. So one of the really important things that they helped was, not only picking what methods we used, but what did the focus group interview guide look like? So helping tailor some of those question stems, eliminate question stems, and with that focus on expedience, order the questions so that we're asking the things that are most important first, and less important as we go on. And if there's extra time, kind of the nice to haves towards the bottom. And yeah, that's not something I would have done on my own. Probably would have tried to ask 30 questions in 45 minutes, which is not effective. And so just wanted to say that a little bit before getting into some of the findings. I think I also talked about, knowing how important it was to have the older adults from the SGC help me choose the priorities. And so I talked about the impact across research as being really important to them. A couple of other things that they thought were important to measure were the satisfaction of folks participating in the SGC or partnering on the SGC. We kind of distinguish between participants because there's people out in Hamilton right now that are participants in the trial. So the SGC are our partners. And so asking, so satisfaction was important, respect, diversity. I think from the start, the SGC members and the folks I worked with to design the evaluation thought that the diversity among the members, but also like among the disciplines, so among the service providers, you had transit, library, kind of a whole basket of all the important social services. And so just needed to say that before we got into the findings a little bit. And so this is kind of by the numbers. There were 18 meetings over a 2-year period. 3 of them occurred before March 2020. And so those ones were in person, and the other 15 were virtual. And because I mentioned we did the document analysis of the meeting notes, we were able to see the attendance and show that attendance was hardly ever below 50% of that 26-person council. And one of the, I think, which led us to one of the key things that we did was having those virtual breakout groups and forcing us to get into smaller groups and have smaller discussions, which the evaluation showed was really important to folks. So some of the success, I mentioned we did a survey. The survey had 35% response rate of the 26-person council. Really strong agreement. So either agreeing or strongly agreeing with some of the questions related to each of those domains. So we had questions about respect, which had to do with, do you feel heard and listened to? Questions about diversity. There's diverse people here, diverse perspectives are shared. Satisfaction, being like, I am satisfied, but also, and I like this one a lot, is it is a good participating or being on the council, partnering on the SGC is a good use of my time, which I think is a really nice complement to satisfaction, and impact, which we talked about as well. So impact was all of the methods kind of helped us with impact. But there were also a couple of questions on the survey. So, feeling that emboldened researchers will use the things that I told them. And so I mentioned a little bit, people wanted to show impact throughout the research study. And so there's other engagement papers and researchers that have looked at impact of engagement on different stages of the research cycle. And so the font's kind of small there, but just wanted to say that this comes from a couple of reviews, this idea of thinking about the design phase of research, the execution phase of research, or like the doing, and the translational phase of research, so sharing findings. And so we did find impacts through the focus groups, the survey, and the document review. We were able to find impacts across all of these stages. And basically, to summarize, because I can't go into all of them, some of the impacts were they showed us how to collaborate, who needs to be at the table, how to reach the target population with specific messaging, and who should even be involved, who should be at the table in an SGC. Also talked about, who should lead the program in that execution phase. So who should lead the program, how to operationalize those priority features that we talked about, those flexible ones, and how to mobilize the findings. And so probably because it's the most common spot for partners to be engaged in is some of that translational piece. And I would welcome questions to detail some of the other impacts further. But what we will focus on today is some of the translational impacts. So creating those knowledge products, presenting at conferences. And before I hand it over to Aref, this is kind of like a bunch of quotes, but talking about the process of engagement. So if I had to tell you things to emulate in your own work, this is what we heard made the process of engaging the SGC work really well, which was creating an atmosphere that encourages people to have discussions, trying to create an atmosphere where people felt welcomed, included, and heard, being supportive and responsive, and just communicating clearly, and acronyms, reducing the use of acronyms. And so now I'm going to hand it back over to Aref to talk a little bit about, reflect on his experience doing some of this translation work.
Thank you, Maggie. I think that the most important thing in terms of the impact is getting benefit of the perspective of the participant in terms of the older adult perspective, giving opportunity to the target group, members of the target group, to participate and to participate in co-design. What is mean in co-design, and in thinking with the Embolden team through the whole process, from the preparation, the implementation, monitoring, and evaluation. All this process, the participation of the SGC member, I think that enabled them to capture the ideas, the perspective, what about their priorities, their needs, their problems, their concern. This is, I think, that maybe couldn't done without our participation. Therefore, I think that it is very important to give an opportunity for the target group, a research target group, to participate in order to convey their ideas. For example, that the community is different generation, and sometimes the older generation don't know exactly how the younger generation think and about their priorities, what they like, what they dislike, without a research that convey the ideas, the perspective of the other generation, for example, or the other target group. It is difficult to understand how they think, and it's difficult to convey their ideas to the decision maker who are gonna make a change. Therefore, if we wanted to make a change, it is very important to include and involve the target members of the target group, to let them talk about themselves, whether they are women, disabled, older adults, young children, any target group. It is very important to involve them in the research process.
Thank you, Aref. And I think too, I know just having the SGC members help me with designing the project, picking the methods, helping feed in. So we had the opportunity to present the findings of the evaluation back to the guiding council and get some feedback from council members who didn't help design it as well. And, you know, having those folks just continue to be involved, you know, if you're going to a conference, you know, here guys, here's my abstract. Tell me if I got this right. And so I would say there was like 4 or maybe 5 conferences where I asked for their help before asking them to help me with the paper. And so I think well, I hope, but you can confirm. I feel like that helped the paper not be too much new information because it's like I've been involved in this project. I've seen results in like bullet form and on a poster. So now let's see them long form in a paper. And I would say to summarize, Embolden's used a long-term process to design this intervention that's being used in a trial. And so hopefully we showed you a little bit about how engagement was operationalized in that project, but also in my project as a sub-study, as a student, or trainee, sorry, as a trainee, just to think about how, you know, no one told me that I had to involve older adults to design the project. But that was actually probably the best, like the best idea that I did. And so just like thinking about if you are a trainee, how you can carve out an engagement project for yourself within a big project, I think is pretty cool. And also gives you good leadership skills because you have your own project that you're kind of the lead on, and you don't have feelings that you know you're doing research assistant work. You know, you have your own project that you are in charge of and helping to lead, which is important. And so I think their expertise was really, really important. And hopefully these kind of 2 examples show different ways that engagement can take place, kind of like a micro dose and like a macro dose, or like ongoing engagement. And I would say if you leave with anything from this presentation and when you think about doing engagement work in your own research, is that any project can benefit from having engagement with the target population. And it, like, no matter how small, like some actually is better than none, I think. And I, one of the more helpful pieces of advice that I got was the way that you would tailor any methodology that you would use, it's fine to do that with engagement methods too. And the same way that you report transparently what you did in your regular studies, that's also important in engagement work as well, so that other researchers can learn what works and what doesn't. And I have a checklist that's there too that can help you think about what your engagement might need to look like and what is transparent reporting of your engagement so that other people can learn from it. And I would also just give, had a chance to be involved with a toolkit called the Engage with Impact Toolkit, which if you haven't done any of this work, really helps to think about planning engagement, setting engagement goals, what the process might look like, and then evaluating it. So I think that there isn't as much evaluation of engagement work because folks haven't set out to do evaluation at the start of their project. So it's like, I think if you can think about the goals of your engagement at the outset of your study, how you will, you know, how that will unfold, how you will define the impacts and how you will measure them, that can really help. And I would say there are so many resources on the trainee resources, I think, through the collaborative, if you're thinking about doing engagement work. And they also have some like trainee workbooks to help you kind of work through your planning, work through your meetings. Those would have been really helpful for me had they existed when I was doing this work. But hopefully they'll help you, and that'll be great. So thank you.
Thank you so much. So we have some time for questions for both of you. And I want to start with one. So we do design thinking at MIRA, and one of the things we ask people sometimes is to envision an ideal future state. And I want you to do the opposite and go back in time. If maybe it was another project, maybe Embolden, can you think of times that a project might have been going in a direction that wasn't so great, and that, you know, the impact or the of interacting with whether it's older adults or other users change the trajectory? So I mean, maybe what would Embolden have looked like if not having taken this route? Or I mean, or if you've got lots of other groups that you work with, do you have any examples of times when maybe folks were about to make choices or implement something that wasn't such a great idea?
Thank you. Actually, I wanted to focus on the engagement, the importance of the engagement and the participation of any targeted group. When I came to Canada, I also followed a 2-year course on leadership in community engagement at a McMaster Center for Continuing Education. And I know exactly what does it mean engagement and the impact of the engagement in any community or any research or any community work. Therefore, I think that from my experience and knowledge, I think that I advise the researchers to engage their target groups in order to understand exactly what they are doing and what they are looking for and the exact answer about their research. This is very important. In addition to that, yeah, from my experience, I think that the research is very important in order to make a change in the community. Without the research gives statistics, gives data, gives information that enables the decision maker to make a change in terms of the policies, procedures, in terms of using the best use of the budget. Therefore, I think that research is very important, and also it helps to make a change in the community, and helps to the decision maker to make also a change. I'll give you, for example, back home. When I was working for UN Women, one of our project included a study about violence against women. There were a lot of people who were against this study on the pretext that they are saying that in our community there is no violence against women. But we insisted, and we did. The sample was, or the number of women who participated in that study, 3,000 women. And the findings, we found out that 95% of the women who participated in that research said that they experienced some sort of violence. So the results was shocking to those who said that violence against women is not available. Therefore, we built on this results, and we also we created a lot of projects. For example, building the capacity of women, the empowerment, the capacity of women, economic empowerment, helping them participate in political parties. All these things really get access to loans, for example, to establish their own enterprises. So all these things built on the results of that research. Therefore, research is very important. It gives facts. It shocks sometimes people about their beliefs, their understanding. How do they understand issues? How do they allocate budget? How are they doing? The community itself, for example, can stop the deviation, for example, to what the community doesn't need.
That's a terrific example. Thank you, Aref. Do you have anything to add to that, maybe?
Yeah, I needed to not forget what the question was. And that was, that's a crazy study result. And I feel like that shows how important the results of research can be for advocacy, because you had a shocking result, and then you can, use those results to support things, doing things differently. I would say So thinking about, when engagement might go off path, I would say I'm not thinking of a personal experience right now. First of all, there is a paper. It's written by patients themselves, people that have worked for, like 10 years as patient partners in the healthcare system. And, it wasn't like they ghost wrote the paper. There's no senior researcher on that paper. It's only the patients. And they talk about, that's the name of the paper, is When Engagement Goes Wrong, I think. And so I think focusing a lot on like facilitators and barriers. There's a lot of papers out there that talk about like this is what was like the facilitator to our engagement. And it's actually divided up by like disease groups. So we have all these papers of like, in cancer, here's the facilitators and barriers. In aging, here's facilitators and barriers. In dementia, here's facilitators and barriers. And it's duplicative. So, I mean, obviously hindsight is 2020. But moving past some of like what works and what doesn't, I think asking patients themselves and publishing a paper about this is what wrong looks like is a really powerful example. I would also say that one of my colleagues has a framework about engaging older adults as research partners. And they talk about the importance of clear communication during transition phases of a project. So recognizing that if you want to involve people in different stages of your research, the kind of intensity and frequency might change. And just being really clear about those periods when things change, because you hear lots of stories in those duplicative papers I just mentioned. They talk about, we didn't hear from them. We didn't hear from the researchers for 4 months. And the researchers were like, yeah, we were busy like doing the thing. So just communicating that, we're out there doing the thing and we'll talk to you at this interchange, I think can be really important. I would also, so I have 2 other things to add. Some of what we see is that people become involved in research as research partners for altruistic reasons. They want to make the system better and they want to have impact. So ensure, like knowing that you can craft engagement experiences that have impact, but it requires you to be really transparent about the possibility of impact with your group, which is different from how we write grants, which is like, here, the possibility for impact is like endless and limitless. And like, here's all the possible implications of our work. But being really, really clear. So situations where one person's desire for impact isn't matching up with the project's ability to like do that impact is where I've seen some mismatch. And in the kind of in the spirit of that, a really powerful anecdote that I heard from someone who's worked as a patient partner for a long time. They were talking about, okay, there's the process of being engaged. I can be engaged in a very friendly, nice way that makes me feel really good when I go to the meetings. But if we don't have any impact, like, is that worth my time? She's like, I've had just as good of an experience, and not that I'm endorsing you being gruff in your engagement, future engagement research that you might do. But they said it was just as powerful to me, or almost more powerful, to be, interpersonally gruff with, but I know what I said made a difference in that project. So just being really clear and transparent about the potential for impact, and also like speaking with some people in your target group before you decide what your engagement looks like. I have one other project in mind where I spoke with someone who I think was at a conference or something, and they were working on I think it was folks who were coming to the emergency room, recurring visits related to injection drug use. And this person was very, very smart. They had read all the engagement literature. They were going to co-partner in this project, in this 1-year project with this group, and they were going to reduce all the emergency visits of this group, and it was going to change the health system sustainability. And I was trying not to burst this person's bubble. And I was like, have you talked to any of those people yet? Like, you can read all the engagement literature that you want, but at the end, you have to like meet the group that you hope to work with the level of engagement that they want to do. So even if you want pure engagement or you want a co-partnered project, if the people in your group don't want that, then that's you forcing it on them. So you can't just decide what the kind of level or nature of engagement is before you talk to the people in the group.
Yeah, we have a couple online, and Trish, would you like to unmute yourself and go ahead?
Yeah, hi, my name's Trish Finnegan. I'm joining you from very sunny Tramore in County Waterford in Southern Ireland. I'm a PhD researcher, and I have what I call a research advisory group that's made up of 4 of the stakeholders that are engaged in the project. It's around an age-friendly university for the new university that I'm attached to, Southeast Technological University. So my question after all of that is to ask about the Strategic Guiding Council. You said that there's 26 people on the council. Am I correct in saying that there's 8 older people and 18 practitioners?
Yes.
So how do you get the balance right? To me, that's 8 older people plus 18 practitioners is not an equal engagement with the older people. So how do you make sure that the voices of the older people are heard and that they're empowered to engage on an equal level with those that they may perceive to have more power?
Yeah, I think it's a great point. And I think I would also say that having an equal number of older adults to service providers also wouldn't guarantee that it would be equal engagement, and that kind of like playing that numbers game. It's familiar, but I don't know how helpful it is. And so I would say that I alluded to earlier this idea that we were doing because we ended up going online due to the pandemic, we ended up doing these breakout groups. And so I think we were really strategic in how we managed the breakout groups and kind of decided who was in each group. And I think the facilitators of the breakout groups, there would be a facilitator and usually a note taker as well in each breakout group. And I think the facilitators, were, because I was a note taker, I can say this, we're pretty skilled in managing and making sure that everybody kind of had their say. And I think having those smaller groups really helped us to hear from people that might be more reluctant in a group of 26 to put their hand up. All of a sudden, in a breakout group of 5 or 6, and like I said, I did allude to the attendance being really strong throughout all the meetings, but I would also say that it was the service providers that were more likely on the whole to miss meetings or have other work-related commitments too. So I wouldn't say that the balance in every single meeting was strongly, service provider oriented. And relatedly, I've seen it go the other way as well, like where you have service providers in the room and you have, people with lived experience that have really strong opinions, and it's kind of the service providers that are like marginalized. And I just think that skilled facilitation is really good, and having those small groups to make people feel like they're welcome and invited to share, and it being like less scary than sharing in a room of 30 cubes. It's like a room of 9 cubes. But Aref might have some ideas on that too.
Thank you.
Thank you.
My point of view is the number is not important. I think that the quality of participation is more important. So maybe 10%, but the quality of their participation is low, and maybe 2 persons and the quality of their participation is better. Therefore, I think that the quality of the participation of those who are within the research is very important, and I think that changing persons to make sure that that they have a qualitative input. This is the most important thing. Yeah, balance. How the number. I don't think that a major issue. The major issue is I think it is the qualitative participation. Yeah. For example, let me give you there in terms of the IP member of the parliament. There are many members of the parliament. I can talk about not here, for example, in our countries. There are many members of the parliament, but during their participation is most of them may be silent. They didn't talk anything. They don't bring good ideas. So their participation is not so influential. The influential thing is the qualitative participation of people.
Thank you.
And Trish, that was cool that you're from Ireland and you came to this. Thank you.
Yeah, thank you.
Huma, would you like to go ahead?
Sorry. Yeah, I was trying to connect. Actually, it's supposed to be, and thank you very much for giving me this opportunity to talk. I was supposed to be in person there, but not feeling well. So that's why I don't want to give everyone the infection, but just trying to be a part of this great conversation. My question is that how do you feel that, and what is the strategy of involving the diverse population or community in this collaborative for health and aging in this project? Because I know, like, the diversity is very important these days. I mean, if you talk about the participation in the clinical research, at the same time, there is a particular mindset in different ethnic groups or communities. So it's really hard to get to that point and how to address that. So is there anything in your mind, or you can address that? Thank you so much.
Thank you for that question. And I kind of alluded to this earlier, but in the setting up phases of Embolden, and thinking about who some of the partners might be and some of the folks that, maybe had been involved in a grant submission and who else we might want to involve. And so there was an event that took place with people, folks that I guess it would be like stakeholders or community agencies, and having them invite some of their clients who they thought might be interested in a project like this. One of the important pieces of feedback that was received in doing an evaluation of that event was that, you need the balance. So it kind of relates back to Trish, your question as well, like the balance of older people to service providers and researchers isn't quite right. Like, you need more older adults, and you need to make sure that if you are targeting certain neighborhoods, that the older adults on your council have experience in those neighborhoods. And so I would say having that like push or reminder to bring in different voices, more diverse voices, was really important for the SGC. And I would also say that becoming involved in like a user group or an advisory group, it is almost like a managerial partnering role. And so the analogy that I like to use is, if you're a volunteer at the YMCA, taking tickets at the door, it's much different than being on the board of the YMCA. And so some of this user group or a guiding council work is more administrative in nature. And from what I've seen, people are more likely who've already been maybe participants in a research project are more comfortable moving into those more like managerial or administrative roles versus people who have no experience in research. And so I think where this links back to diversity is that the whole research enterprise lacks ability to bring in diverse folks. So we're not so good at having diverse research participants, and it's reflected in our research partners as well, because it's challenging to jump in, right at the board level. So that's not to blame the whole research enterprise for it being challenging to have diverse partners, but more just to say that it is challenging, and the only way that we were able to, make any change in this area was asking our partners for help. We asked our community agencies for help. We worked with, some settlement and immigration agencies that had experience with diverse older adults. And I would say that that's where the majority of our strategic guiding council folks came from. And so, yeah, I would say that having those links with community agencies that have a good reputation in the community and are trusted was super helpful for us. But yeah, there's more room, I think, for the whole research enterprise to do better here. And I think research partnerships will become more diverse when research studies become more diverse too. Like, I think it's a direction we all need to do better in, for sure. Do you have anything to add?
Thank you. I think that concerning the involving the target groups, I advise every research team to replicate the embolden experience in terms of the engaging the target groups. What the Embolden did, there is the awareness about their study. They make a presentation. They did a presentation in a lot of community organization, and they could attract different participants to join the Embolden study. This is one. The second one, also the innovative experience of the Embolden is that they created a virtual communication tool or forum that is the SGC, in order to enable the participant to get together, to communicate, and to express their views and ideas. And this is, I think that this forum is one feature of the success, or one reason of the success of this engagement. Yeah, therefore, I think that the Embolden has a good experience replicating the best practice of the Embolden in terms of the engaging people. I think that it's worth it to replicate. Thank you.
I'm not too clear about it, but if you can.
Thank you. Should we ask Rebecca to unmute and ask her question?
Sure. So thanks so much. I just wanted to jump into the conversation a little bit. First, I want to start by thanking Maggie and Aref for just an exceptional job. You really always are such great champions of Embolden. So really thank you for sharing all of your great insights. I did want to pick up on a couple of things that the previous audience members have said. One of the things, I think, Trish, you picked up on a really important point, and it is essential. So I think, Maggie and Aref have said it's not necessarily about the number, but really being aware of power dynamics is so important and essential. And so I think being strategic about how you ensure that everyone who's part of that group feels part of the conversation and that their contributions are valued is so critical. Similar to Maggie saying that the number of older adult partners in our team grew over time, so did our organizational partners. So we didn't start at 26, but it grew, and it was an exciting way that it grew because there was so much community engagement around shared priorities. And we knew it needed to work for older adults, but we also knew it needed to work in the workflow of the community providers who had so much expertise in working with those older people in the communities. So one of the ways was we had meetings, but we also had the opportunities for communication outside of meetings. So if anyone wasn't comfortable outside of the group or within the larger group speaking their ideas, we often had people share after a meeting some things that they continued to think about, or new ideas, or answers to some of the questions in the meetings. So those are other ways. And I think we also heard from all of our partners that we were asking them about what the impact was, but they also told us, well, you need to tell us, what the impacts are. And so the importance of closing the loop. And I wanted that to be a takeaway for the audience as well, about how important it is to
value, acknowledge what you've heard, but also to close the loop with people about how your work was changed, especially, you know, as Maggie said, when people go out and do the work between meetings, like, so being transparent about how it changed. And in many cases for us, it changed for the better. And I think it's just, I do want to challenge Maggie. One of the things that you said was that because we don't engage people as participants, then we don't engage them as partners. But I think it's really valuable if we can engage diverse partners to help us to better reach the community members. And I think that actually helped in this example, but it can help in other examples as well, to be able to then do that outreach and have the messages that will really resonate and reach people who aren't typically, we're not often as researchers as successful at reaching. And I think the onus is on us about the reaching those communities. So anyways, I just wanted to chime in with some comments. Thanks again so much. And I'll turn it over to the audience for other questions.
That's so great that you went back to Trish's idea too, because something came to me since she asked, which was the only way you'll actually know if you are effectively managing the power relations in your group is to ask the people who are in your group. And so I think that's one of the, like, that's what this project served to do also, was ask people, how is the engagement going? What could we improve? And I know in some groups that Rebecca and I have worked on, it's there's space at the end of meetings to say, like, we end this meeting 10 minutes early on purpose to give some time for you guys to say, like, are we engaging you in the right way? Is this working for you? We have engagement evaluation surveys that we've sent out to the group. But yeah, just leaving time and asking folks, because yeah, you won't, it might seem like you're doing it wrong, but maybe you're not. And yeah.
Yeah, I think, sorry, you did right. You did right. I think that the Embolden team could succeed the influential role that they played in terms of the of raising the satisfaction of the participant, because they are in the Embolden team involved the SGC members in the whole process. For example, they shared the agenda before a time before the meeting, and they give an opportunity for the participant to make their comments on the agenda and also they give us to make a comments on the minutes of the meeting, and also the while the meeting is going on, we feel that we participate with our ideas, and we make a comments, we discuss, not that the Embolden team inform us what they are doing, but the other way, they let us feel that we are participate in building this process. And this is, I think, that create some sort of liability and loyalty and ownership and satisfaction, all these things, because of the good management of this forum. And I think that this is a successful experience, needs to be replicated.
Thank you. My question is really, I was a participant of the Embolden, and I understand it's ongoing. And I wonder when is your endpoint? And I'm looking forward to hearing the results of that.
Give that to Maggie or to the big boss in the sky here.
That is a great question. And so we are currently implementing in our second to last neighborhood in Hamilton. So that neighborhood began on April 3rd, and then we have one more neighborhood in the city of Hamilton, and then there are 2 Toronto neighborhoods as well. That will occur kind of like spring, summer, and we are just kind of finalizing the partnerships for those 2 neighborhoods. But so you will have to wait, I would say, I don't know how long it will actually take us to analyze the results, But there are 3 more neighborhoods at 12 weeks each. But yeah, great question. I did have a where are we now slide that I took out.
Actually, the impact of the results, it's a long term. For example, this project this study is happening in certain neighborhood. There are a lot of people who get aware about the importance of the objectives of the emboldened terms. For example, the physical movement, mobility, physical practices, healthy food, and social engaging in social activities. But how many persons, how many families practice this, get benefit of this? I think that it is a long-term evaluation to find out the results. Because I can say myself, I get benefit of this, of these things. For example, yeah, I'm living in a building. It is in the 7th floor. Yeah, since I joined to the Embolden, I stopped using the elevator. I'm climbing the stairs to the 7th floor, up and down. Yeah, I'm to improve on my physical movement and physical activity. I can say that I get benefit of it. Is a result of the Embolden. How many get benefit? Because you know that raising awareness, raising in the neighborhood. I'm sure that there are a lot of people who practice or who get benefit of this information, knowledge, and all these.
We're antsy for the results too.
Okay, so I think now would be a good time to close out the seminar portion of this. I have a couple of slides to show you so that you'll come back and do more fun things with us. But following this, we're going to transition into more of a trainee and publication-oriented conversation. So if you are a community member and you want to do more things like this slide is for you. Or if you're a trainee or researcher, so here are some of the things that are coming up. We'll be visiting the Hamilton Public Libraries through June and July as well, I think, right? Yes. So the first one is with Ian Bruce, who's fantastic. He is working with the Hamilton Philharmonic Orchestra on a project around hearing loss and enjoying music, and what can we do to better improve the science around that. And he's going to give a great talk there. And then Allison and I will be there to hear more from you, from older adults, about what you think the university and MIRA and everyone should do to better engage older adults in research. Following that, James McKinley will be there talking on behalf of the Optimal Aging Portal, which is a terrific tool you should check out. And then Sophini Subramanian, one of our wonderful trainees, will be talking about technology mobility. Each of those will also be followed by a workshop where we want to hear from the folks at the library about what we can do to sort of best engage with older adults, bring them to campus, go see them, bring research to them. Second, this is the thank you. Oh, right. These are trainee things, so lots of fun and exciting trainee events coming up. There's a QR code there to join the collaborative. So check out the collaborative's Learning Hub. If you're a trainee, you can also participate in the collaborative's 5-minute thesis event. We've also got Picture Project coming up at the Phoenix. I think there will be snacks and beer, Shazine. Regular trainee meeting where it's just informal opportunity for trainees to get together, and a scholarship writing 6th, correct? Okay. And so last slide, thanking the funders, all of them, and on brand with our theme. We want to know what you think, what we can do better, what we can do more of, what we can do less of. Please tell us. Thank you very much to our speakers and to everybody who came.